I just like to say that I get excited about shiny objects. So currently on the Femtech Focus mission. So Femtech is the innovation in women's health and wellness. I'm literally just fighting for women's health equality because it is so out of date, whether that's med device, consumer products, or diagnostics. And so Femtech Focus is actually a nonprofit that I operate. We have the #1 Femtech podcast in the world, Femtech Focus. Check it out, Spotify and iTunes. I've done over 100 interviews with Femtech experts, and we provide resources and opportunity to Femtech founders through our virtual network and our events.
Love it. And for those that don't know what Femtech is, can you just, what is, have this female technology? What does that mean?
Yeah. So Femtech is any innovation, product, or service that addresses anything that affects women, girls, or females. And so what I mean by that is anything that solely, disproportionately, or differently affects women. So solely is menopause. Differently is the symptoms for heart attack are different in women than they are in men. Most people don't know that. And then also disproportionately affecting women. So autoimmune disease, 90% of those patients are women. Alzheimer's patients, twice as likely to get Alzheimer's if you're a woman rather than a man, and we don't know why. And so Femtech is this idea that healthcare has been always viewed through a male lens, whether we thought it was or not. And now we're finally saying we need to create data, create products, create innovation specifically for women because we're not just little men.
I think that is it's so needed in the space. I remember I worked for a period of time at Johnson & Johnson that owns the Stay Free brand of sanitary pads for women, and was baffled at at the time, this was years ago, but at the design was all by men, the leadership, a lot of men. So it's much needed as it impacts the innovation in the space.
Many products in Femtech are one and done, if there even is a product or a solution. So if you think about it, the FemCare aisle, the last innovation for incontinence, which 1 in 3 women experience incontinence, the last innovation was diapers. Like that is what Femtech is. It's literally like, we deserve an update.
I love it. So when you dive in and think about specifically Femtech Focus, what are some of the things you all are doing as a part of that networking community?
Well, the first thing is the podcast. It's just bringing awareness to it. You asked, well, what is Femtech? A lot of people think it means female founder. In fact, it does not mean female founder. I'm quite bullish on more men needing to found women's health companies, because we don't just birth women. If you improve women's health, you improve everyone's health. And so it's not about just female founders. So the podcast is about awareness, but we also do a lot of research. It was just, in October of 2020, we finally figured out what the market size was for menopause. Previous to that, founders were having to just calculate, well, I sell it for this much and this many 55-year-old women are in the US, so I'll just make a market size that way. So we do a lot of publications and research that way. We also have a bi-weekly webinar called Femtech Fundamentals, where I teach founders of Femtech, but also about any other industry could probably be useful as well, basic fundraising, marketing strategy, legal, FDA regulatory, because Femtech has unique barriers. For example, in Vogue, you can say penis, but you can't say vagina. We have unique barriers to digital ads, unique barriers to pitching to a room full of men that have no uterus and have no idea what we're talking about when we say PMS, what that really means. And so I really address, here's some entrepreneurship lessons that are be useful, but also how is this unique to Femtech founders and how do we overcome those barriers?
Absolutely. And to share with the audience a little bit about your background, I would love to hear about how you ended up focusing on this area. For those that don't know, you have a doctorate in molecular and human genetics. I can hardly say it. So, but if you can share let's go back to your early startup journey. If you can share with the audience a little bit more of that. What was that first startup that you worked on, and what made the shift from being a PhD to being a founder?
Absolutely. So I am as nerdy as they come. I actually have DNA double helix tattooed on my arm. My dog's names are Tripsin and Cork. If you know what these are, you're probably a nerd too. And I was pursuing my PhD in molecular and human genetics, and I realized that I had way too much personality to work in a laboratory for the rest of my life. No one got my jokes. I always dyed my hair crazy colors, and I just found it really hard to make friends in grad school, honestly. And so I thought, I can't spend the rest of my life here in this sterile laboratory. I love it, but I can't physically connect with these people. So I started to investigate what are other careers that a PhD could have. And, I tried a bunch of different, panels and events that I went to, and I found the entrepreneurs, the startup people, the founder people. And I was like, oh, this is my tribe. We're super nerdy and intelligent about a specific topic because we're PhDs, but we're like visionaries. We imagine the future of what this could be. And we do not want to just research and publish papers and hope that in 30 years it amounts to something. Entrepreneurship is about, I want to have an idea and next week I want to start testing it, and by next year I want everyone using it. So I loved that idea, that impact, that real life impact. And I had a crazy idea. I was, 22-ish and super single, and I was swiping on the Tinder and the Bumble and all of the dating apps. And I thought, why can't we use DNA to help find love? And I would tell my friends, well, I want to start a company, but I just have a crazy idea for a DNA-based dating app. And everyone said, that's not crazy. That's cool. You should totally do that. And so in 2016, I started my first biotech company called Faramore. Faramore turned into the first nationwide DNA-based dating app. And it was based on old science. Quite honestly, science I had learned in college as basic fundamentals of attraction, which is you actually have genes that encode for certain proteins, and scientists can predict who will be attracted to who based on these genes. So I used this established science, made a dating app, fundraised a bunch of capital, built the app, launched it, helped a bunch of people find love through DNA. And it was a crazy and fun ride. Amazing
journey. So what took you from launching your startup in Houston, you stayed in Houston, to become an investor at Capital Factory?
Yeah. So like 9 out of 10 startups, Faramore died. And I don't feel like we talk enough about those failures, right? What happened was in 2019, Apple changed their policies in their app store, not allowing just any app to ask for your genome. Previously, they didn't have any kind of restrictions. As a geneticist, I think that's excellent. We should not just be giving our DNA to anyone who can make an app. But unfortunately, as a businesswoman, it was not good because dating apps were prohibited from asking for your DNA. So we got kicked off the app store. My Series A fell through and I had to close the company. I had an identity crisis. I thought I let every female founder in the world down. Like, it was horrible. So if anyone's listening and you're going through that right now, I promise you, you're just one step closer to your $1 billion exit. That's all that means. You're on your way. So once Faramore closed, I needed a job. Quite honestly, I needed a job. And there was an opening at Capital Factory, the most active venture fund in Texas, based in Austin. I had been in the Houston market, well known there, and they hired me to launch their Houston branch. And, one of the biggest lessons I took away from becoming a senior venture associate at a venture fund was that I had always thought that investors were so smart and so superior, and that I should be afraid, and that they're just so much more savvy. And then I became one, and I sat with them and I worked with them as colleagues. And I was like, no, they're just humans. In fact, the founders know a lot more than we do most of the time.
They're the experts.
They're the experts.
The founders are spending day in, day out with their head to the grindstone, and they're the experts in their field. Yep. Yeah.
And so it just totally turned it on my head. And I just thought, I need to let the founders know that they should chill and that investors are not that scary. And so I've really become a founder advocate for fundraising.
Amazing. So and shifting back to, you talk about launching a startup in the space and then shifting to investing. You probably have seen quite a bit in biotech, genetics, DNA. Can you share with the audience? There are many founders and also investors. What are the trends that individuals should be looking to build their next ventures in, as well as invest in the DNA and genetic space?
Definitely. Well, if you're going to do anything in genetics, make sure you have somebody who can write great algorithms, because it really is about the data and how you mine it and how you figure things out within it. So there's a lot of new, if we look at diagnostics and personalized medicine, there's a lot of new tests coming out that say, hey, we could take a saliva test and find out if you have X, Y, or Z. So there's an autism test now. And again, it was because a algorithm, PhD in data analytics, somebody out there did enough algorithms with enough data sets and said, oh my gosh, if this individual has these markers, they have autism, right? And so a deal I'm really excited about right now is Prime Genomics. They're creating a saliva-based breast cancer test. I'm very excited. It's literally disrupting the mammogram industry. And if anyone has breasts and has had a mammogram, you'll say hallelujah, because we need another test for this type of stuff. And so I'm really excited for the future of genetics. I don't think we're anywhere near like cloning or editing our genome. I've cloned and edited genomes in bacteria as my PhD. It's very messy, and it's not, I think that's very far away. And right now I'm focused on diagnostics genetics, so we can get more specific and accurate results. Also, I'm really excited about us finally diversifying the database for genome. So the vast majority, I'm talking like over 95% of reference genomes, the ones we use to like discover stuff, is all male Caucasians. And we cannot give drugs or diagnoses to Black people based on white people's DNA as our reference. That does not make sense. And so I think if 2020 provided us anything, one of the things it provided us was looking at health inequalities amongst race, and genetics absolutely is very far behind, and we need people to pioneer that mission.
That's great. So diagnosis is definitely one area, more immediate commercialization than I say designer babies is where people say that there'll be money in the future, right? When you're able to, focus on genomes, but while people are in development, which is pretty scary. But what other areas do you see are infrastructure that needed to build around the industry for this space? Like, what will be possible that wasn't possible before?
Wow, that is a big question. I'll give you two answers. The first one is, I actually think we need more like policy. So if you think about designer babies, I'm a geneticist. I've taken enough ethics classes on this. Yes, we could cure things like cystic fibrosis through editing a genome, but if somebody discovered the gene that makes you homosexual and someone said that was a disease, then we could potentially have doctors out there editing out homosexual genes because it's a disease. And so it's like, talk about a can of worms. And then all of a sudden scientists are like, should we even research, should we even open this can of worms? So I actually say the first thing we need is a lot of policy and really, really smart people working on policy, not just capitalists, including investors and stuff, and not just scientists who are just curious individuals, right? So we need policymakers and ethics people. But we also need assays. So when I say assays, pharmaceutical companies, they like to run big tests for very cheap to figure out which candidates they should follow through with. Did you know there is no assay to figure out if a drug is going to affect a fetus in utero? We find that out when it's in the market. Isn't that insane? So when you're hearing all of these things about the COVID vaccine and it says, if you're breastfeeding or pregnant, ask your doctor, that's because no one's tested it and likely no one will. And by the way, the doctors don't have some insider info that the rest of us don't have. So when I think about the future of genetics, I also think about like very, very, very upstream, what are laboratory assays that are scalable and cheap enough that big pharmaceutical companies could use them to discover new things. That's a big answer. I hope that was okay.
No, I appreciate that. I think that is that's excellent because it gives a lay of the land on what is really needed in the space. So, if you can share, I know many investors that they go to the investor side and they shift back to the founder side. And I tell investors all the time, I was like, hey, like founders, where I said being a founder is where you ultimately want to be. But you know, and you made that leap back into being a founder. If you could share a little bit more color around your decision to start not only Femtech Focus, but Founders Compass. I know you're an instructor in that as well.
Yes. So what happened was I actually was just looking for another VC job in Femtech. I found Femtech. Again, if anyone's tuning in now, it's innovation in women's health and wellness. I fell in love with it. I fell in love with it for three main reasons. The first is that I am a total nerd. We've covered this. And Femtech has a lot to do with biology and cycles and your life and hormones. So the nerd in me just loves it. Number two, it's a total activist move. We're fighting for women's health equality. Women are dying. I am twice as likely to die from childbirth than my own mother. Maternal mortality rates are increasing. So it's an activist move. And third, I'm an investor, and menopause is a $600 billion market. Femtech is a $1 trillion market, and no one is working in it yet. It's emerging, which sounds insane because women in medicine have been around for like ever. So it's a smart investor move. So I fell in love with it and I thought, I'm going to go work at a Femtech fund. And so in, I would say very early 2020, or late 2019, I was looking for Femtech funds and job positions. And I only found one. I only found Portfolio. And I was like, where's the annual conferences? Where are the meetups? Where's the Femtech Slack channel? Like, where are the Femtech things for me to do? And I realized, oh my gosh, that's actually what my job is. My job is to create an ecosystem, or at least connect the little silos that I did come across. And since then, we now have about 6 Femtech funds that I'm aware of, and we do have a growing ecosystem where we're creating connectivity amongst it so that we have that network effect and we're growing. But yeah, I was actually just looking for an investor job, and then I found myself becoming a founder because what do founders do? They have problems and then they solve them, right? So here I am.
Great. And shifting, you know, it's important shifting into the space. Can you talk about the boundaries of Femtech? Because I think you can get into a place. It's not products just geared toward women. It deals with, you said, health and wellness as well, right? So yeah, can you speak to where that boundary is for you think in the industry?
Interesting question, because I have seen some products that they say they're Femtech, and I'm like, this is a not true example, but I'm going to give you a crazy example so we all get the picture here. Let's say there's an app that helps you schedule when to do the dishes. Just because women most often are the ones that do the dishes in the household does not mean that your app is therefore Femtech because your main user is a woman. In fact, what you're doing is just deepening the social stigma of what is a woman's job versus a man's job and everything in between. So it is interesting to kind of sit back sometimes and have to inform people like that is not the case. Again, I feel like Femtech, where is the line between it's just women users versus it's women's health? Let's say there's another Femtech company called Wild.ai. They're going to essentially be the next MyFitnessPal, but for women. And you could say, well, is that just, because it's just going to be used by women? So is that really Femtech? It is Femtech because it's actually the first fitness program that takes into account your menstrual cycle. to date, there is no fitness tracking app or Fitbit or whatever, Apple Health, that offers you 7 days that says, oh, this is right before your period, you deserve to sleep more. Or, oh, like you're in your period, you should rest more for your fitness. I have many friends that got pregnant and their Apple Health app says, you're overeating, you're not moving enough. And they're like, why is there not a pregnancy setting on my fitness stuff? Like why is that not even an option? And so when I think about, Wild.ai is a fitness app for women, it has algorithms in a design that's made specifically for women. So I don't know if that kind of clarifies the difference there.
That's great. That's great. And looking at it, especially now, right? I think when I think about the femtech space, and part of the reason we reached out to Brittany to come talk about the femtech space is what you said. It's like over $1 trillion when you add up all the different areas, right? That make up femtech, and it's being spent today. It's not even an emerging space. A traditional emerging space is like VR, right? There aren't. The VR that's being developed is not being used by a large population today. This is different, where the industry is reorganizing per se, right? And how they define instead of just health, they're portioning out women's health and wellness as its own category. What else do you believe? Here the question needs to happen in order to accelerate innovation in the femtech field?
Oh, okay. Wish list. Here it is. We need men talking about periods. I think a lot of deals get done because an angel or a VC will hear a pitch and maybe they don't quite understand it. So they need to go and talk to their friends or their family about it. Now, not every investor who has ever put money into, let's say, blockchain probably understands it, but they talked about it with their friends and they got enough of their colleagues and network to say, yeah, I believe in it too, because they talked about it. How many male general partners will talk to more than just their wife, because the N of 1 is not a sample size that is good enough. So how many guys are going to play golf or have dinner with friends and talking about periods? Let's say they have lots of women friends. How many men are going to their women friends asking them about their periods and if they have endometriosis? These are conversations that usually aren't happening in our circles because of culture and just taboo topics like menopause. And is she going to be offended if I ask? Without us talking about women's health issues, we don't realize how prevalent the problem is. 1 in 10 women have endometriosis. There's 55 million women with symptoms of menopause, right? These are huge prevalent things. So I think for us to have innovation, we need to talk about periods. We need to actually say vulva instead of vagina. We need to actually know what the right words are for these things too. So we just need to talk about it. And that's a big reason we have our podcast. And then I think the other way is to just kind of ask ourselves, well, is this a status quo thing that I think is good enough? So we talked before about the panty liners for incontinence. Diapers were the last innovation for that. And now we have companies like Finesse creating these little, they're so cool. They're very cute too. There's these little foam things. They look like little airplanes. And they actually put pressure right on the urethra opening in the woman. It's not about catching her urine. It's about pressuring the urethra enough to make it not leak, right? That's innovation. So what is the status quo? Another company, I have so many, obviously, I have lots of examples, but another one more. I was mentoring a founder the other day, and it's a male femtech founder. Again, men, please come and help us. It is the first medical device for C-sections. I said, what are you talking about? What do they currently use? He said there requires 3 sets of hands to hold women's stomachs open to get babies out. And I said, they don't use med device. No, there's some abdomen tools that they'll use, but so he's creating the first ever oval, crank open thing to hold it open so the baby comes out. So I want to ask you, innovators out there, what do you think that we're doing that is just status quo that you're I bet if somebody mildly smart thought about this, it could be improved wildly?
Absolutely, you can see the continued innovation in the space. Even a few years ago, it was actually my sister was telling me about the Diva Cup and was
Mhm.
explaining to me, right? Like I was like, what is this and why is it important? And talking about like reduction of waste and like you're saying, like the original design was by a male, and then trying to come up
Uh-huh.
with another alternative that actually just creates less waste for and you think about it outside the US where they don't have the same access to um, more disposable alternatives.
Mhm.
It's a great solution. So
Absolutely.
um,
And then if you think about convenience for women, we're busy. We're CEOs now. We're on boards of publicly traded companies. I don't have time to go to the restroom every 4 hours to change my tampon. Diva cups, you can wear them all 24 hours if you want. You can have sex with it in, right? There's these like things where it's like, hey, if a woman got her choice about this design, what would she implement, right? And it's not bacteria filled cotton swab that she has to change every 4 hours, right? Like if a woman made it, that's not what she'd make.
yep, there you go. And there was one story that on thinks and I don't know if this is true, but
Okay.
heard the story about the founder was going to pitch to VCs, and VCs were like, I don't understand, and they brought a traditional sanitary pad and told the VC, go to the bathroom, put this on, like, and made them, the guy, put it on and come back and go, how does that feel? And to so they don't have to think about it. They're living the experience. So it's important not only to have to look for those solutions, but I say also to have more females in the investor driver's seat, so that
Yes.
you have the lived experience, and you don't need the explaining, because you
That's right.
have that exposure and lens. So
Well, that's actually why we're launching Femtech Angels.
there you go.
Because we are going to have a group of investors that already know vaginas need innovating, right? They already know what menopause is. They already so founders unfortunately are burdened with 10 slides of what is a period, right? Like they're burdened with this like education of like sex ed, and so our angel network is going to be people who are already aware. And if they're not, we're going to have resources for them to figure out, read on their own time. And the founders are going to tell us about their innovation and the market size and their business model and their exit strategy. We're going to get down to business, because what we know is that femtech makes money. There's been 36 exits in the last 10 years, 4 of them over $1 billion. So we've had 4 unicorns, and everyone's like, oh, wish we had a femtech exit. And I'm like, we do. There's a lot. Okay. And part of our femtech angel network is going to be all gendered angels, so men and women, right? And we're going to be able to have those conversations. Like I was saying, like the women are going to be okay talking about their periods with the male investors who are still learning. It's going to be very, the culture of it. I'm really excited about being a millennial starting an angel network. It's not going to be your classic old stuffy 7 a.m. breakfast angel network. All right. It's going to be Slack channels and monday.com. All right. Like that's what this angel network is going to be. And I'm excited to get first time angel that are women involved, because these are women who have the money. Less than 1% of high net worth women in the United States have made a startup investment. And I think that femtech is actually the best way to get them into becoming bigger angels, LPs and funds, because it might be hard to convince them to invest in crypto. Not so hard to say, oh, like you have PCOS, this is a startup solving it, I'm really excited about like killing 2 birds with 1 stone, for lack of a better term, funding femtech, getting more women in investing.
Beautiful. So for those, Brittany, it was a pleasure. Thank you for sharing your knowledge with the audience. For those that are looking to stay connected to Femtech Focus, the link is in the podcast notes. Thank you again for joining us today for Rebel One Live, and please come back next week to hear more from CEOs and VCs in the startup space. So thanks again, Brittany.
Thanks, Sergio.